Hey guys, hope you're well. Super quick video about empathy. Do you know how to do empathy in your role plays, whether it's RCA, whether it's plab 2, CSA, or any other kind of OSCE type role play based assessment? I'm Dr. Arora from Arora Medical Education, and I get asked this question a lot by doctors going through these kind of exams. Maybe they've given some feedback, they've been told you need to show more empathy, maybe they've done some mocks, they've been told that you're not empathetic enough, and they come to me saying, how do I do it? How do I improve that? Now, the first thing I would say is, look, being doctors, having seen patients for years, you've developed your own form of empathy, okay? You could not have got to this stage and not been empathetic as a doctor, okay? There's no right or wrong way to do it. That's the first thing, and you already know how to do it. That's the second thing to remember. Empathy can be ranging on a scale, okay? Someone might show empathy by becoming silent. Someone might show empathy by nodding. Someone might show empathy by repeating what the person said back to them. Someone might show empathy by using certain lines like, gosh, this must be really difficult. Some people might show empathy by talking more or less than they normally would. See, what I'm trying to say is there is no one fire way to show empathy. And if you do try and learn how to be empathetic, if you learn these phrases that are supposed to show empathy or that are supposed to demonstrate empathy, trust me, when it's being looked at from somebody else watching, the reverse happens, okay? It looks like it's obvious that you're trying to show empathy. It looks like, okay, gosh, this person is saying things or doing things that they would never do. They clearly don't do in real life. They clearly don't do in normal practice, but they're doing it for exam purposes, and it's just not them. It's not their unique style. So when it comes to empathy, sometimes just active nodding is fine. Sometimes just being silent and waiting for them to say the next line is fine. Sometimes putting in the odd line that, if this was me in your position, I'd feel just as embarrassed as you, or I'd be finding it just as difficult as you are, swapping chairs for 30 seconds. Sometimes it's saying those lines like, gosh, this must be really tough. I can see this has taken a lot out of you. Say those lines do work, but they're different approaches work in different situations, and you cannot have a one size fits all. And the most important thing is you cannot become a different type of empathetic doctor just for the purpose of an exam, because it will have the opposite effect, okay? It'll have the opposite effect on an assessor, but also it'll have an opposite effect on the role player or the patient that you're consulting with, because they will feel that this is not right. They will feel that this is cold or rehearsed or practiced. So if you're watching this video and you've been thinking about empathy and trying to be more empathetic, just take a few steps back, okay? Remember that you have your own style. There is no way that you cannot be practicing clinically and not have developed an empathetic side of you, because if you hadn't, it would have been picked up by now, okay? The feedback would have come back and you would have had to, someone would have mentioned it to you in real practice, not in a mock exam, and not in a mock environment, okay? It's one thing someone's telling you you're not empathetic enough in a mock exam or as feedback in a role play. Don't listen too much to that, okay? Because what they think you should be doing is not necessarily how you do empathy. So have confidence, trust your own ability that you know what you're doing, and that you will be able to adapt naturally as a human being and as a clinician when the need for empathy occurs. And just go back to those basics that, look, I just need to connect with that patient. I need to show genuineness to that patient. And the way I may do that may be different to the way somebody else does it. Really hope this helps. We have loads more teaching on consultation skills, making the best out of your role plays, getting that rapport as good as you can in all of our videos on YouTube, on Facebook, on Instagram. But we also have 10% off any of our teaching courses for consultation-based skills exams like plab 2, like RCA, like CSA. Make sure you use the coupon Arora Video 10, ARORAVIDEO10, whether it's our online courses, live courses, mocks, audiobooks, or any other way that we can help you get through your consultation-based OSCE exams. I really hope this helps. Hopefully you can share, comment, and like if you found it useful as well. #CampusWillPass, #I went with Arora. Have a great day.